Welcome AMRelay, and thank you to the previous presenters. My name is Mauro Tobin, and I'm part of the AOS Health initiative to mobilise health data to fight disease through provision of digital tools and services optimised for use in low middle income countries. Our platform has widespread reuse across different disease verticals such as TB, COVID and malaria. Today, however, we'll be looking specifically at how our digital tools and services are being used to address the needs of responding to rising antimicrobial resistance. And we'll do this from a data mobilisation and management perspective. In this presentation, we'll be exploring our approach to gathering, using and sharing One Health AMR data. We'll also follow this with a video presenting and highlighting our multi-sectorial work in Zambia with their AMR Coordinating Committee chaired by the Zambian National Public Health Institute. And this work resulted in the launch of their One Health AMR surveillance system. We'll finish with some words regarding sustainability, but first a short presentation on AOS Health and using digital tools to combat AMR. Paper is where data goes to die. The inefficiencies and inaccuracies of manual paper-based data collection and management are well understood. The manual entry of information from paper sources into digital sources is prone to transcription errors. It's time-consuming and often results in incomplete and inaccurate records. Sharing of data is key to supporting the objectives of universal health coverage, but setting up data interoperability can be complex. Manual extraction and loading of data, or even copying digital information onto paper in order to rekey into digital systems, is nothing short of a connectivity crime, yet we see this happening all around us. And so we witness already busy healthcare professionals being further burdened by the demand to collect the rich data inputs needed to respond to some of the world's biggest public health challenges. The success of universal health coverage and indeed pandemic preparedness lies in the digital and on increasing the richness, timeliness and scope of collected data whilst decreasing the burden on data collection. AOS Health is an initiative that brings together a partnership of domain experts from 3 founding organisations: eSHIFT Partner Network, Software for Health Foundation and Blue Frontier. Catalysed by AMR data management projects sponsored by FIND, the Foundation for Innovative New Diagnostics, AOS Health have established an innovative set of open source platform tools and a unique set of services in order to assist low and middle income countries to establish digital infrastructures and data management services to address the needs of AMR data collection, analysis and action. This partnership allows us to draw on the vast array of skills and talents, ranging, for example, from health information management expertise, software development, through to data security, to AMR laboratory and clinical practice. Our innovations provide a platform which can be used in the first instance to get data from the numerous and diverse data sources such as manual entry from spreadsheets and software systems via their electronic interfaces. Data usage is achieved through a combination of pre-configured applications, dashboards and reports alongside the tools required to create fully customizable outputs. When it comes to sharing data, our mantra is simple: no new data silos here. Handling AMR One Health data is complex and by definition requires incorporating a diverse range of data from across human, animal and environmental resistance testing. This includes support for drug combinations and quantitative and qualitative results. For AMR, our systems have done the heavy lifting in terms of enabling users to get data from numerous and diverse data sources. And this occurs by providing data entry forms, for example, for AST and DST results, allowing data transmission directly from WhoNet and spreadsheet files, and supporting electronic integrations with centralized data warehouses and LIS systems such as CLab. Additionally, our partition and go technology allows us to offer survey tools such as ODK and CS Pro as part of the system install to complement data gathering and analysis. We take a One Health multi-sectorial view and therefore provide options for input of AMU and AMC data, along with a roadmap of user-driven innovations to allow us to continue to build our ability to get data. Dashboards and visualizations that might have been developed as a specific requirement for one customer will be made available to all existing and new users via package upgrades, so growing the strength and impact of our systems. Our systems ship with modules to support data sharing with established AMR networks such as the WHO GLASS and WOWIS reporting. Our no new silos here mentality means that we can respond and adapt to users' data sharing needs. Our open source approach means users can innovate for themselves on the platform. Our organic approach invites the sharing of all innovations with the community. In short, you don't need to throw away any of your old systems in order to accommodate ours. Our vision is to assist LMICs to rapidly deploy AMR surveillance systems which can grow to support ongoing national programs, as well as contribute to the growing number of multinational and global data sharing networks. We see our technologies, philosophies and services as contributing to the ecosystem of tools and techniques which will need to be deployed in the coming years to establish AMR data sources throughout all low middle income countries. In short, along with our fellow innovators, we are laying down the digital railway tracks for the future, tracks which will allow AMR relevant data to be aggregated and acted on to ensure that the hardest to reach populations and those most affected by AMR are not left behind in the fight against rising antimicrobial resistance.
So like most African countries, we have the challenge of TB, we have the challenge of HIV, we have the challenge of malaria. There are certain practices that accelerate the rate at which these organisms resist the effects of medication, and these mostly have to do with misuse and overuse of antimicrobials, among other things.
The way we're using antibiotics is one where we're encouraging those mutations to go faster.
It's not just a biochemical microbiology issue. There's behavioural issues and there's economic issues. So an example of the behavioural issues is this expectation that people have when they visit or have an encounter with the healthcare system that they will be given drugs. So you're basically now introducing antimicrobials into the environment where there is no particular need for it.
Everyone takes antibiotics. Everybody needs to, cure themselves when they're affected by bacteria and pathogens.
How do we manage this growing resistance?
The data that we're going to need, the information that we need to understand this problem is broad. It's wide and deep, and we are exactly positioned to contribute to the definition of what we need to monitor.
You have multiple sources of data across multiple domains that need to be brought together in such a way that it can be analysed. So there's a lot of innovation, there's a lot of playing with data.
Obviously, in line with international best practice, that you have a way of collecting this data into one system that enables you to analyze it holistically and then better inform decision making, especially considering the nature of what we are dealing with. AMR cuts across different sectors.
So it's not just an issue of human health. We're also required to look at animal health, the food chain, and the environment in general, because antimicrobials are used broadly across all those sectors.
We're looking to bring that information together and provide countries, the global community, with some kind of a dashboard on what the current situation is.
One health, one surveillance. It's an easy to use system. I like the way it's organized. I like the way it's able to pull up dashboards. I like the way you are able to access it anywhere because it's a web-based system.
So the more turnkey the solutions are, the better. And the contribution that Blue Frontier is making to this is in the development of the middleware and those integrated solutions and the tailoring of those solutions to those specific use cases. So AMR being one of them, TB being another, HIV.
Finds brought together the right set of partners with the engineering skills and acumen, the expertise in terms of what's happening at the country level, the knowledge about what the global community sees as relevant in terms of how digital health projects are done.
Companies like eSHIFT really help out because they have got a lot of experience in teaching and training programs so that they can ensure that these things exist beyond the scope of the project.
So this is really empowering healthcare providers to build these data management systems very, very quickly and abstracting away from them the enormous complexities of dealing with multiple input sources and having that data immediately integrated into output surveillance systems.
It proved to be something doable, and we've done it. So the first lesson we have learned is that there's nothing impossible. If you set your mind to it, you can do it.
I hope we have provided you with a flavour of our work and the scope of our services, as well as the nature of our digital tools, and that you can appreciate our team's ongoing focus on both supporting services that are in operational use, as well as being focused on the continuous development of our platforms. The biggest challenge, however, that AOS Health, along with other innovators, face in scaling such open source platform offerings is sustainability. How to ensure that our implementations continue to deliver value whilst maintaining performance, compatibility, and most importantly, security. How do we ensure that today's implementation project does not end up in the virtual cupboard collecting dust along with other promising innovations that have failed to scale or be sustained despite the benefit that they may bring? To avoid this, we need to ensure sustainable deployment of systems, the ability to continue to provide education, experience building, and critical system maintenance beyond the lifetime of the implementation engagements. We also need to maintain existing open source projects to ensure that they are secure, efficient, and remain relevant. So as developers and implementers, we can ensure sustainability through development of upgradable, useful and working technology backed by a network of sustained organisations, and also look to empower a local ecosystem of in-country practitioners and suppliers who are able to adopt and manage individual in-country implementations. AOS Health is therefore embarking on efforts to secure operational funds to allow us to sustain our existing implementations beyond the end of their grants, and to secure core funds to evolve the platform, host a digital dialogue with the community, and foster in-country innovations and capabilities. So if you're either interested in contributing to our innovations or in using our platform services to either strengthen your One Health AMR systems or look at other wider applications such as connected TB diagnostics, then we'd be delighted to talk to you. I would like now to thank you all for your time and to the organisers for providing us with this opportunity to contribute, and I wish good luck to the up-and-coming presenters. I'm delighted now, therefore, as a representative of AOS Health to hand over the AMR relay baton. Thank you all.